Hi, my name is Lee, and I'm here at Aultman Hospital with Lori Schaffner. Lori's a nurse at our Aultman Pain Management, and she is going to talk to you today about understanding pain and control strategies. Thank you so much, Lori, for being here.
Yes, I'm very excited to be here to talk about this complex subject and sometimes even a mystery to a lot of people. A little bit about myself. I've been with Altman for my whole nursing career, which is 44 years. And I've also done some other things in the community as far as jobs. I worked at Stark County YMCA's for close to 30 years in their training and coordinating of CPR and first aid, that kind of thing. Done camp nursing and also did some home health and some occupational health. But all that time I remained also at Altman and have landed with the Working on Wellness team, which is a community based nursing group, and also pain management, which I've been working really in that arena for about 20 years. But my whole career, you're involved with helping people figure out what's causing their pain and how to make them feel better. So I'm going to go ahead and get started here. We're going to follow along with some slides. Very first thing is next, go ahead and talk about the definition of pain. And so when we look at pain, the definition we get is defined as a physical suffering or discomfort caused by illness or injury, unpleasant feeling that is conveyed to the brain by sensory neurons. And so what happens is you have nerve endings all over your body, on your skin, muscles, joints, and so forth. And when they are tickled or fired off, they'll send a message up to your brain saying, hey, that doesn't feel good. And you all know what some of those things are, like, okay, I'm getting burned. Something, I just smashed my finger in a door, and you get a sensory sensation to your brain real quick. Like some people define pain as the body's defense mechanism to pain and to protect it, to know when something is wrong. So we get those messages, and we often do protect ourselves by pulling away from the hot subject, by maybe if we fall and hurt ourselves, we look down and say, okay, that ankle is not normal. So we stop doing something. So that kind of thing kind of helps us know what's driving our pain, what has caused our pain. So that all becomes part of it. Next. So pain sensation is influenced by a lot of different things you wouldn't even understand really you believe in, emotional responses, your cultural beliefs, physical input, your cognitive interpretation, and then personal history with your pain experiences. So if we look at each one of those, emotional responses, believe it or not, your response to pain is formulated even as a young child. So, how your parents reacted to you when you got hurt somehow develops your response to pain. So, how this has been described to me at other seminars is like the parent that has a child fall down, and they kind of wait and see what's the child's response going to be. If they are a parent that rushes over and says, "Oh my goodness, are you okay?" Right away, the child is in a heightened state and thinks, "Okay, I'm not okay." And maybe they'll start crying. Other parents are more like, "I'll wait and see if they cry, then I'll go over." So those kinds of techniques, if you will, or responses starts to formulate how you respond to your pain very early on in life. Cultural beliefs hinge on things like um, stiff upper lip. Some cultures don't believe in maybe going and getting help, maybe telling the doctor. Certainly, I've seen that in my career where we say, "Why did you wait so long?" Well, I just thought it would get better, or I'm tough, that kind of thing. So that has a play on the problems and how your pain is interpreted to yourself through some of your cultural standards. Physical input again is what has happened. I mean, if you look down and see that your arm is at a weird angle, you have a bone protruding, then that's going to have input on your pain sensation. Your cognitive interpretation is kind of your knowledge of what is causing you pain. And we're going to talk a lot today about cognitive interpretation and some other things along those lines as we go on. Um, But having a knowledge of, oh, this happened to me, so this is going to hurt, but I can run cold water on it and help it. Or I can get an ice bag or a heating pad. We kind of understand from other experiences, which goes on to the next point there, how to manage our pain. So that all plays into the cessation of pain and how that's influenced in our response. Now, if we move on to pain classification, so next. These are the three classifications of pain. And you might not have heard of these things, or you might have, but I want to go over them so you sort of understand and have a knowledge about them. So, nociceptive pain is the kind of pain we have often, maybe strains, sprains, burns, bumps. These are nerve endings in the skin, the muscle, the joints, the bone. They sense and respond, as I said earlier, the message to the brain that, oh, I'm having pain. And, you might have a day where you have this happen to you a lot, like you bumped your arm and then you stubbed your toe and then you got a paper cut. That's all sort of examples of nociceptive pain. And you know how to deal with that because those are pains that you've had experience with. Now, neuropathic pain is pain that develops when the nervous system is damaged due to a disease or some kind of injury. Usually, those kinds of symptoms are like tingling, burning, numbness. We see these kind of things like with back injuries, with what we call a disc rupture, where it's pushing on the actual nerve root, causing pain and sensation, which then flows down the leg if it's in the back, or maybe if you're having a neck problem, it's going to follow the nerves into your arm, shoulders, and fingers and that kind of thing. And you have that kind of pain. So that's what we call neuropathic pain. Then we have inflammatory conditions, which is the immune system sending out inflammatory cells to attack bacteria at a damage point. And these cells also can start to do that when you're not having damage and then become what we call chronic inflammation. And you see these in some disease processes. Some inflammation is what we consider it's a good thing. The body is healing. It goes, let's say you have a cut. The body sends out these cells to help take care of that cut. And so you have a little inflammatory response with redness, warmth, and maybe some pain at that site. And these are kinds of things where you'd say, well, I took an anti-inflammatory because I injured my ankle or I had a cut and it was hurting, that kind of thing. But sometimes the inflammatory response can be chronic when there really is no longer a real reason for it. But it also does happen in a lot of disease processes. If we go ahead and skip through to pain intensity, pain intensity is often stated in three formats. So mild, moderate, and severe. So a mild, it's generally something that happens that causes a small amount of pain, a small amount of discomfort. Maybe you don't even think about it. Moderate is, okay, this is bothersome. And we'll talk about how you're going to scale that in a little bit here. And then severe, of course, being some of the worst pain that you can imagine. So those are some of the words that we use. And there's a lot more descriptive terms that go into pain management as well as when we decide to actually describe that to our primary care physician. So going on next to pain duration. And this is where it becomes really part of the crux of the matter, where you're really trying to understand what's causing this. Why is it still happening? And this is what I see in working in pain management is the chronic pain. So acute pain is pain that, and you can go to the next slide. So acute pain that is 4 weeks or less. So it can be dependent on the cause of pain. So we have a sort of a funny little cartoon here of you noticing the nurse probably asking a question, well, where is your pain? Well, the obvious thing, he's having acute pain from a knife in his back. So sometimes we joke about those kinds of things when we are asking people about their pain because they kind of look at us like, well, it's because I just broke my hand, But acute pain is usually defined as pain that is 4 weeks or less. And it is dependent on what your problem was. Was it due to surgery? Was it due to an injury? Was it due to a disease process? This pain is usually, like I said, short lived. We have ways that we can deal with that and move on. And like I said, most often we put that in a category of being 4 weeks or less. If we then move on, next slide, to chronic pain, this is where we really get into more of a problem. If you can see there, the numbers on that last statement, 100 million people in the US are dealing with chronic pain. That has an annual cost of over $635 billion. And included in that is care, is lost wages, is money in productivity lost for our companies and our employers. So, chronic pain, most often defined as pain that lasts longer than 3 months, despite medication or some kind of treatment. And not surprisingly, the most common chronic pain include arthritis, back pain, and neck pain. I've read studies that show that there is about 60% of Americans that would deal with some kind of chronic pain, especially back pain. So that's something that I see a lot where I work. And we notice that a lot just across the board. And if you talk to anybody, friends, family, you might hear that, like, I threw my back out or my back is bothering me. And part of that does come from a lot of different things, body mechanics, um, maybe having a previous injury. Those kinds of things lead to that. So that's why a lot of people seek help, is because of that back pain. So pain itself, if we move on, can cause a lot of things. And it kind of becomes a vicious cycle when we're talking about chronic pain. It can cause depression, anxiety, inactivity, and you have reduced time with family and friends. So I always tell my patients sometimes that pain becomes that third person in a couple relationship or that fifth family member. You're always doing things around what your pain is doing. Always scheduling because I feel better in the afternoon than I do in the morning. So it really plays into your life and can put a dent in how you live your life. As far as depression goes, it can cause depression. And also, we know from studies that people who suffer from untreated depression have more pain or um, perceive their pain as being worse. So it's important. And now we especially know right now with the big um, focus on mental health, we know that depression is really important to get treated because we know that folks that have untreated depression or anxiety problems have an increase in their pain management, in their pain perception as well. Inactivity is one of those things where it's a double-edged sword. I'm inactive because I have pain. The more that I'm inactive, then the more pain I start to have because other things happen. Your muscles tighten up, your tendons shrink up, you have other things happening. And you can see inactivity in just even small everyday things. For example, I work with people that are in front of the computer a lot. I myself spend more time in front of the computer than I ever did. And we know that that kind of posturing starts to work on the muscles, the front muscles, the back muscles. You start to get crouched over in your shoulders, and you also can have a bad posture. Having bad posture can lead to a variety of kind of chronic muscle fatigue and pain. So I have some different things that I have given to some of our folks that work with computers that says, hey, every so often you need to do certain stretches, you need to move. So that's really important when we're thinking about inactivity. And I know a lot of times we tell our patients, you've got to move within the parameters of what you can do. And so that becomes really important. So next, let's talk a little bit about describing and description. like this slide shows, pain becomes one of the hardest symptoms to relay to your health provider. It's probably the most difficult thing people have describing. We have different things that we can use. You may be asked for a numerical scale. You may choose from a list of descriptive words like aching, burning, dull, sharp, constant. I can't sleep at night. We look at that a lot as to how much sleep you're getting. Now, you might know that right now there's a lot being said about the importance of sleep. And so we are starting to look at that even with pain management. How well do you sleep? You even might have a chart with facial images. Now, a little bit about the history of um, pain management being a fifth vital sign. People ask me about that. I think it's something that is people know about. That came about in the late 90s, early 2000s. Some people say that originated in the Veterans Hospital. Other ones, the Joint Commission for the Accreditation of Hospitals, made it important that besides checking your four vital signs, you also check pain management. So we often will ask, are you having pain? What level is it? So next, you'll see a pain assessment tool like this that will, and this is one that's most commonly used now, and we are actually updating our information at the pain center to reflect that. So the pain assessment tool might look something like this, where you have 0 to 2, 3-ish is a mild pain, and so forth. You can see the different parameters there and where it goes. One thing I notice in my practice, and we usually tell patients 10 is the worst possible pain you could ever imagine in your life. And so we have a lot of people come in and say they're in 10, their pain is 10. Yet maybe I saw them walk down the hall, they were laughing and joking with the nurse, they're talking to the person that brought them. Um, they're able to communicate, they're not crying. So really we're trying to educate what your real pain is. And a lot of times our patients come in and they tell us that they're a 10. Every time they come to see us at pain management, they're a 10, which they believe that if they don't say they're a 10, that we won't help them. But in reality, if they're already a 10, it looks like we're not doing anything to help you. So it's really important to pay attention to what that pain is and to get a idea in your own mind what your worst pain is. I'll use my husband for an example. He is a kidney stone sufferer, which can elicit a lot of pain. It's one of the worst things that you can have is a kidney stone. And so he compares all his pain to that kidney stone. So sometimes I look, if he would get injured, I think, oh man, that hurts. It's like, oh no, that's nothing, because he's comparing it to that kidney stone. So we need to get better as a population, as patients and caregivers, to explain that better and to be able to get a really good assessment of where that pain is. So moving on now to some strategies, some options for controlling pain. And a lot of that depends on the symptoms, the onset of the symptoms, the type of pain, again, your history, past responses. And we did talk a little bit about this, that a lot of people will manage their own pain. Your day-to-day pain, you'll manage, you'll have experience of what to do, or maybe you'll go on to a reputable website and see what you need to do for certain things, or you'll maybe stop by a minute clinic, or you'll go to an immediate care, or you'll call your family physician, or maybe this is something, this is an emergency room visit. So those things all play out in when you're deciding how to manage certain types of pain. In treatments of chronic pain, what happens, you probably be screened by your physician, your primary care physician. They might order different modalities of treatment like physical therapy, might try things like a TENS unit, might try other kinds of treatments like massage therapy, acupuncture, a specialist that deal with making sure that if you have depression, that it's treated, because that might be what's driving your pain. So that's important. And if they continue to have a problem as your family physician and really can't get to controlling your pain, you might be referred then to a pain management center. So next at Aultman, our Aultman Center for Pain Management, some of the various treatments that we offer for chronic pain include the epidural steroid injections for neck and back injuries, nerve blocks. I've seen those used for people that are really having what we would consider acute pain, but it would be from something like shingles, which is very painful. And when they have those, we can go in with injections and try to dull that pain. Trigger point injections, which are usually muscle injections to help relieve some pain from maybe inactivity or other disease processes. Spinal cord stimulator trials we do at pain management. Also refer people to physical therapy. And another thing we do is the radio frequency ablation. We do that where we would then burn the nerve, the sensory nerves to the back. And you have to go through some diagnostic tests to make sure this would be an option for you. And hopefully, with this treatment on certain types of problems, you would be able to have pain control for several months. We also do a type of uh, ablation for knee pain as well. And these folks get relief that would last months, which then would um, be able to decrease the amount of pain medicine they're using, the amount of steroid we're giving, and have a better quality of life. And a lot of times we tell our patients, we can't change what's going on back there. We can't change what's happening in your spine or what's happening in your neck or wherever your problem is. We can help maybe to reduce that inflammatory process, that inflammatory response, or that nerve response. And also part of that becomes the patient responsibility too. And there's a lot of things out there with that now. I also want to make a little commercial for Altman's new back program that they're doing that is run by our physical therapy department and also has a number of other people that are other entities that are involved with that. I just read this that Altman Therapy is also starting a new kind of therapy for jaw pain. So that is new and out there. Altman also offers massage therapy. We are seeing more insurances pay for these kinds of things, not as many as we'd like. But our massage therapy, I know, is a little bit cheaper than maybe going to other massage places. And the massage therapy, if you want to jot this down for Altman up there at Altman North, is you call this number 330-244-8113. And so those are things that can help. Um, Also, just things controlling different aspects of your life also helps with these things. So if we go on, what else? So yes, more and more we see new studies. And if you're interested in studies, if you're a research guru like I am, or you want new knowledge, which is very important in handling your pain, is having knowledge about it. It's really great to go to NIH, which is the National Institutes of Health, which is our government's arm of health and wellness. They are the medical group in America that does the medical research. So they have lots of information out there. Anybody can go to NIH website and dive through their different departments and get information actually sent to your home in print or look through it online. But I love NIH and some of the work they're doing for pain management and pain control. So I always tell people if you're going to go online, please go to reputable sites um, that where you get your best information. So, research being done with chronic pain. There's so much more being done, and we are finding more and more. For example, there has been recent studies and research done with opioid use versus traditional medications. And that's not my forte, medication. I'm not a prescriber of medication. I don't work in that arena in pain management. But what I do know from experience with patients and from the latest studies out there and the latest criteria for helping people deal with pain is that studies have shown, and some of these are very recent studies, that people that are given Tylenol or other over the counter anti inflammatories, either together or in conjunction, have have just as much control of their pain than those that are given opioids. And we do know about the opioid crisis, and of course, that's a whole nother health talk. So there's other types of over-the-counter options as well. Um, Things that you couldn't get a few years ago. I mean, you can get topical anesthetics now to rub on things that's developed goes in through your skin. Some of those things are anti-inflammatory in nature. Some are local anesthetic. So those are things that can be used. A lot of folks like to use those types of modalities of treatment because it doesn't go through their stomachs, has less side effects, but still, because it's a lotion or cream doesn't mean you can just go crazy on it. It's a medication. You still need to read your directions carefully and make sure you follow those directions or talk to your doctor about, can I use this? How should I use it? Can I use it in conjunction with medications I'm already on? And make sure there's no dangers out there. So next slide. And so what else is there? There's so much more. Like I said, research is being done, especially in this field of chronic pain, since it affects so many people in America on their day-to-day life. Research continues to show one of my big mantras at pain management: motion is lotion for the body. Inactivity can lead to more problems and actually increase your pain, which I know is hard for people to grasp, but because they say I can't move because I'm in pain. But yet there are so many studies that show when people start to move within their pain parameters that they get a decrease in their pain. So maybe you can only do something with your arms. Maybe you can only sit and bicycle with one of those little bicycle gadgets that you spin your legs on. You need to find what you can do. You need to find that what that is. I've had patients tell me, yes, I couldn't walk around the block, but I decided to try. I decided to do it. And when they got into that cognitive control of their behavior and how they focus on their pain, they got relief. Your pain, especially if you have chronic pain, a lot of doctors say we're not going to heal it. We want to control it. We want to do the best we can with it. So that becomes sort of your response to it. And, I put a little plug in there about smoking cessation. I am a certified tobacco treatment specialist. The number one thing you can do to improve your health across the board, and it plays into pain management as well. So we often have talks with our patients about trying to get them off the horrible addiction of nicotine, because it does, from studies, show that it does. People do have an increased type of pain when they are smokers. So that's an important tool, and that's a very hard thing to do, but we have ways to help you. We have a program here at Aultman, the Give It Up program. We have many tobacco treatment specialists that help you. We run the classes. Ohio has the 1-800-QUIT NOW line. There's just a lot of ways you can get help with that. The other modalities of treatment, like we touched on: massage, yoga, weight control, walking programs. These are all things that you can do. Recently, I actually was looking at our local public libraries that, if you look at their programs, they've had programs on cognitive brain therapy, which we're going to discuss here in a second. They've had programs on diabetes. They've had programs on, right now, they're running a program on healthy diet. Let's see, I'll give them a commercial. Um, Eat Smart, Live Strong. That is in September and October. So if you've got your flyer from the library, I think everybody gets it that lives in Stark County. So check that out, that they do have some health things in there. So those are good ways to get more information, to learn more about what you can do on these other strategies to help your pain. Some of the other things that we find, as far as what else is there, is your response, your outlook, your emotional response to your pain. Studies have shown that people that are more optimistic, that get up in the morning and say, I can cope, instead of I can't cope, do better. So really using your mind, using that cognitive brain control, um, those people do better. They report less pain. They report a more active lifestyle within the parameters of their pain. And so those things become really important. And we're seeing a lot more studies being done on that kind of response to your pain, that I am able to do this and this and this, even though I can't do ABC anymore. And sometimes part of that just becomes what one of our doctors like to say, AGE, as we all get older, what we need to change, what we need to think about what we're doing, and how we might. I have people tell me, for instance, that they want to garden for 4 to 6 hours. And because that's what they used to do. But then after they do that, they can't move for several days because they put extra pressure on their back or whatever their problem might be, exacerbated by that. And so we have to try to find a formula, work for 20 minutes and then stand up, do some stretchings, move around. And those things are really helpful in trying to manage. You're never going to be able, it's fun to go back and be like you're 30, but the body is not going to let you do that very much. So those are all important things to think about. I encourage you to look at some of them. And people I know, yoga, sometimes I get the funny faces about that because they picture themselves on the ground in some kind of pretzel formation. But believe me, you can take chair yoga. You can take some of these classes for pain sufferers. There's DVDs in your library. There's things online. There's YouTube videos for people that have pain and how to move and how to stretch. I read a study where 60% of, I think it was 200 to 300 people, which is, some people think that's a small study, some think that's a large study. 60% felt that their pain was better controlled after they went through an 8-week course of involving yoga in their treatment. So that's pretty significant. Weight control, of course, when you have excess weight on your bones and muscles, this can lead to extra problems, extra pain. And there's lots of programs out there to help with that. Walking programs, boy, our parks have some great walking programs. You can get one started yourself with other people. During my research for this program, I came across a lot of groups that you can join, that you can read about, that kind of share their journey on what can help with pain reduction. Next slide. So one of my things that I really like to talk about is to let nature help. I am a certified naturalist for the state of Ohio, so I have a lot of belief in the importance of nature, and it's just not coming from Lori. It's coming from studies that have shown this, that it continues to show the importance of connecting with nature. And interesting enough, the local parks and our state parks had a great influx of people during the pandemic because guess what? It made them feel better. But we know from studies that being in nature can lower your pulse rate, lower your blood pressure, and also lower your pain. So it's important to have that connection. Even if you're not able to get off your porch, go onto your porch, watch the birds, get distracted of what's going on. These kinds of things decrease pain levels. It's been shown in studies. So it's really important to look at that as another modality of care for yourself, to let nature help you along with that. In Stark County, they actually have a mindfulness trail out there at Petros Park, which is for people that are struggling with not only emotional issues, but with pain management. Those kinds of things would help with pain management. The looking outside yourself, as in volunteering, studies have shown that people that are involved in volunteering, involved in other groups, involved with family, as in maybe, yes, I'm going to babysit for my grandchildren, or I'm going to go and be a mentor at the schools. People that get involved in something outside themselves have more positive results in regards to their pain levels. So these are all things that we see people doing, and they have a better response. And they're looking at a lot of this now through different studies. Next slide. So then we say, next, But wait, there's more. You've heard that a lot of times. These are even more things that are starting to get a foothold in pain management, if you will. Mindfulness based stress reduction. We know that reducing stress, and we talk about that a lot in people's lives. Hey, you need to reduce your stress because that is going to play into having less pain. So there's actually mindfulness based stress reduction that you can learn how to do. And I believe that these are some of the things that you'll see classes on in line. You might see these kinds of things offered at maybe even one of our health talks, maybe other local entities like the library, or like even each of the parks locally run different programs, and some of these things are based on this. CBT, the cognitive behavior therapy. So that has gotten a lot of press lately. And, cognitive is how we learn and have knowledge about our pain. So, really, that part of it is learning about our pain, being very involved in understanding in depth what causes your pain. So many times I will say that our patients will come and say, wow, a doctor never showed me that. For instance, we'll take a model in of the spine and show them the vertebrae, show them the disc, show them that disc protruding and pushing on the nerves, show them how the nerves come out and feed down to the legs and the feet and the toes. And so that gives them a knowledge of understanding what that is. And that becomes part of understanding your pain and how to deal with that. They know through this that changing negative thoughts and behavior towards their pain helps people develop better coping skills. Like I said earlier, just by saying, I'm getting up today and I can cope with this, people do better from that idea. The behavior part of cognitive behavior therapy is learning what you can do, really being in the mode of, I know I feel better when I walk. And so I am going to do that behavior. I'm going to make that a part of my life. I'm going to make that important and figure out how I can do that. And so, really applying that behavior. And that becomes very important. I do that a lot when I work with people that are trying to give up smoking. So we use a lot about changing behavior, how to incorporate new behaviors, and that becomes something that you just have to work on. It's not something that happens overnight. It's not something that you can do quickly. It becomes part of planning. It becomes part of your daily activities. I know people, for instance, that have MS, and that can be a very tiring disease. And both these people that I know are very adamant of when they take a nap. I know not to call my friend at 2 p.m. because that is her nap time. And that helps her with the rest of her day. It helps her have a good quality of life. You wouldn't even know that she's an MS um, patient because of how she is cognitively aware of her pain, what's causing it, and the behavior that has started to control her problems. A PMR is something that is also relatively new. I wouldn't say, if you looked at it, you wouldn't say, oh, that's not new. I've heard of that before, but it's something that we're looking at as being a way to help control your pain. And so that becomes, and it's something that people have, if you take any kind of yoga, a lot of times people do this at the end of yoga where they'll say, lie down, get comfortable, squeeze your muscles and then relax them. Make a concerted effort to relax. And the example I'll use sort of on this is myself. Um, Sometimes when I lay down, I feel like I'm not letting the pillow do its job. I'm like laying there and like pushing against it. So you have to, um, in your mind, say, okay, I've got to relax those neck muscles. I have to relax that jaw, and you don't even realize that you're doing these things. So this type of modality of treatment is teaching you to understand when your muscles are tense, understand how to relax them, and it becomes a practice. It's not just something you, okay, I'm going to do that. we have flyers that we can hand out to people that guide them through that. And I'm sure that you can go online and go onto YouTube and look up progressive muscle relaxation, and someone will probably guide you through that with nice music and with prompts that tell you what to do. And that can be very useful in pain control. So, our next slide, pain. What is it good for? I had to put that in. Absolutely nothing, the guy says in the movie, right? But we know that pain is good for letting us know if we need to fight or flight, if we need to remove that hand from the iron, if we have something that we need further help on. When it becomes chronic, sometimes it does become absolutely nothing. This is not helping me with my life. But we know that there's ways. There's people that you can reach that can help you, that can be with you on this journey, if you will, um, to help you still have a good quality of life. So I encourage you to reach out, have those talks with your primary care physician. That's usually where it starts out, or your advanced practice nurse, on what can be done, what things can you do, learning more about the details of your pain. So cognitively, you have that knowledge of what is happening to better understand what you can do to help yourself.